would be great. Thank you. So we're going to be talking with Dr. Courtney Luking and Cindy Sullivan, and I'll do a little bit more of an introduction of them in just a few minutes on building healthy habits in early childhood. DPH, or Department of Public Health, has received a federal grant to increase nutrition and healthy habits in all childhood, but have some specific things focused on early childhood that we're going to be talking about today. But before we get started, I do have a couple of things that I would like to say. As always, welcome to this month's CECC webinar. We're very excited to have you and excited to have these folks joining us today. As you all know, we are moving into FY21 as of next week. So I want to do a brief just thank you to everybody that has served up to this point. If we have chairs that will be leaving us and new chairs coming on. So we'll talk a little bit about that before we get started with the building healthy eating habits and physical activity. We are going to have some time for questions and comments at the very end. And then at the very, very end, we do have a couple of updates for you guys as we move forward into the next fiscal year. So as you guys know, every time we have one of these, I always like to go back to Governor Andy Beshear. I think we are in month 4 of the COVID-19 pandemic. Everyone working from home, working really hard, and we just have to remember that we'll get through this, and we'll get through this together. And another one that I always like to remind everybody that the community early childhood councils are such a key part of the work that we do. And we are a small but mighty group in early childhood. And I just like to remind everybody that of this Margaret Mead quote here: don't ever think that a small group of dedicated individuals cannot change the world. Indeed, it's the only thing that ever has. And I always like to think of that quote as we're talking with you guys, because really the councils are the local folks that make sure that early childhood is a focus of the community. So as we go into kind of the thank you portion, I thought it might be a good idea to kind of remind ourselves what the CECCs are and what function they play in the early childhood system. So the CECCs were built to create innovative and collaborative partnerships that promote school readiness for children and families in the local community. And the councils have always been a part of the system for early childhood in the state. You know, every year we do the grant process so you guys can have family engagement and professional trainings in your local community, and to really bring that community-based collaborative together to make sure that all folks keep early childhood in mind as they're working. And as we continue to grow and expand with different opportunities from a federal level, the CECCs always play an important and critical component of those grant deliverables. We did with Race to the Top, the Early Learning Challenge grant, and with the Preschool Development grant that is ending. And the work that you guys do is so flexible and dynamic to be able to quickly respond to what the Early Childhood Advisory Council sees as the work that needs to be done. So you guys always do a fantastic job of that. So with all of that, again, I would just like to say thank you to all of those chairs that have served over the course of the last year. As you're moving out, your leadership has been so important to the work that we do on a statewide level. And we really hope that we can continue to work together, that you're still working with your CECC, and that we can really, you've just been such a leader. And for those of you that are coming on as new chairs, thank you for your dedication to early childhood. I'm super excited to work with you over the course of the next year to put all of the pieces together. And if you have any questions or concerns or any of that kind of work, don't ever hesitate to reach out to myself, to Savannah, or anybody in our office. So with that, I'm going to go ahead and turn it over to Dr. Courtney Luking. She's an assistant extension professor and an extension specialist in health and nutrition with the Department of Dietetics and Human Nutrition at the University of Kentucky. And also we have Cindy Sullivan, the Early Childhood Education Program Coordinator with the Health and Promotion Branch of the Department of Public Health. So with that, thank you guys so much for joining us today. We're very excited to hear what you have to present, and you can go.
Wonderful. Thank you for that introduction, Amanda. Is my sound okay at the moment?
It sure is.
Okay, I always panic with these. It goes well in practice and then I go live and something happens. But thank you so much for having us here today. I am excited to spend some time with you all this morning to talk about current and future initiatives that can support healthy early care and education environments across Kentucky. In our time together today, I will be talking about or bringing up 4 topics of conversation.
Before we get too much further, I'm not seeing your PowerPoint.
Oh, okay. Let's see.
Up there at the top, there's a little button that says share.
Share.
Yeah, and then you should be able to share your PowerPoint from that. There you go.
See that? Okay, great.
Yes.
All right, let's go back to that. Sorry, it's my first time using WebEx for delivery. All right. So now, so our 4 topics of conversation today, we are going to highlight the role of nutrition and physical activity in early childhood and explain the role that Kentucky's state and physical activity and nutrition program has to promote policy, system, and environmental changes in the childcare setting in ways that can support healthy eating and physical activity. We'll also discuss the newly signed legislation to elevate the nutrition and physical activity standards within early care and education settings. And finally, introduce Go NAPSACC, which is a tool that will soon be available for use across Kentucky by the childcare settings at your local level. And before we dive in too far, I would like to hear from you all. And I invite you to head to the website menti.com. That's MENTI.com and use the code 732533. And this is going to allow us to create a live word cloud. So I'll see if I can share the right screen for you. But I want you to respond to this prompt. What about nutrition and physical activity in early childhood is important to you and or those in your community? So let me know. Do you see a white screen now?
Not yet.
Not seeing a white screen, Courtney, but would you mind reading that code again?
I will. Okay.
I see the white screen. Yeah. Here we go.
Okay, there we go. So the website is menti.com, MENTI.com, and the code is 732533. You can use your computer if you're logging in through that. You can also do this through your phone. And as you type in your words or the thoughts that come to your mind, they should begin populating. So I'll give you all a few seconds. There we go. Access, education, and equity. And again, that question is, what about nutrition and physical activity in early childhood is important to you and your community?
It looks like we do have someone with a dog in the background, so if you wouldn't mind going ahead and muting, that would be great.
All right, so it looks like education is one of the primary interests that you have about nutrition and physical activity, and we'll talk about that. Choices, actual nutrition, access. Can we access the food to nourish our bodies? Do we have access to safe physical activity, perhaps? Obesity, so concerns about energy regulation from an early age and what that could mean in the long run. All right, the thoughts are flowing now. Health, overall health, availability. Looks like access is a primary concern. And I imagine that has always been a priority, but perhaps with our current state, it could be that there is an increased concern about that. Awesome. So choices, education, equity, access, families, scheduling, understanding kind of what it is, what are our healthy targets. Great. Thank you so much for participating in that. I am going to switch back to the PowerPoint now. And I promise that is the only switching that I will do. All right. And so we should be back to our PowerPoint. So thank you for taking some time to enter your thoughts. I think you all were kind of hitting the nail on the head in the words and the phrases that you were describing. And I know that you all are advocates and invested in early childhood, and this might not be new information for you, but I wanted to reiterate the importance of early childhood as the foundation for lifelong health. That time from conception to age 6 is particularly significant, partially because of the time of rapid growth and development, those ongoing connections that are laying the foundation for future function. And this is going to be impacting children's short-term and longer-term physical health, their cognitive development, their social health, and emotional. So really all of those aspects of a developing and healthy child. I also wanted to point out that the evidence shows that disparities in health and development are rooted in this early period. This could be due to experiences related to poverty, safety and stability of a home environment, or perhaps the lack thereof, as well as the early education opportunities that are provided. And these factors are going to affect the trajectory of a child's development. These are just a few examples of things that can leave lasting imprints on children. And what I'd like to talk about next is the role that nutrition and physical activity during that early childhood play on having a lasting imprint for a child's growth and development. The preferences and habits that children establish in early childhood, so their dietary habits, their physical activity habits, those are going to have short and long-term impacts. These preferences actually can track into adulthood. So that is one of the reasons it is important to create a functional and healthy start. Poor nutrition and physical activity habits in early childhood are linked with an increased risk for chronic diseases such as type 2 diabetes, hypertension, heart disease, and obesity. And this puts children at higher risk at an earlier age, and this too can track into adulthood. A child's nutrition and physical activity habits can also influence their school readiness, which I know is a key priority of this group. And the unfortunate news is that a majority of children in our state and nationwide are not meeting recommendations for health promoting dietary and physical activity patterns. And this begs the question then of what can we do to ensure that children have the support they need for healthy beginnings and a healthy future? And kind of the short answer is there are a lot of opportunities, and I would love to in the future learn more about what you all are doing at a local level. But I love this diagram because it highlights the different levels of opportunities in which we can foster healthier beginnings. This in the center, you can see our little children here. At the core of our concentric circles, you can think of an onion, but I've been told onions are a bad example because not a lot of people like onions. So you can think of an artichoke or something more pleasant. But each child has genetics and biology that is independent and personal to them. And their biology is going to interact with and inform in kind of a two-way manner. You can think about it as two-way communication within the social and physical contexts within which they live. And so thinking about the people that they spend time with and the physical spaces that they live, learn, and play. And then children are also functioning within institutions. I think one of the most relevant examples at this level for this group are early care and education settings. And then realizing that children and their families are living and playing and learning within communities, whether that's communities of people or communities defined by geographical boundaries. And then we have this really higher level public policy. This could be local policies within a specific town or district, and it could be even larger at the state and national level. And today we're going to highlight ongoing and future opportunities that target many of these levels in ways that support those most in need. And so, Savannah, if you want to go ahead and pull up a first poll, I am trying to build some engagement in as we go through this, so you're not just staring at a screen for the duration of our conversation. But our first poll question is going to help us transition into our next topic on the agenda, and that's the state physical activity and nutrition program. And so wanting to get a sense of whether you've heard of it or maybe how much you know. So I think if we can give her a few seconds, that should pop up shortly.
And this is the first time that we have done anything like this on one of our webinars. So for those of you that are at your computer, what will happen is you should see over on the right-hand side, there will be a little polling pop-up where you can see like where the chat box is. The poll should pop up there as soon as Savannah gets it in there. And I know that it does take a couple of minutes to transfer that over. So let's just give her a couple more seconds. There we go.
There it is. Great. So the question is, what do you know about the state physical activity and nutrition program? The first answer option is, I have no idea what you're talking about. The second one is maybe I've heard about it at some point. The third option is, this is going on in my community. And the fourth option is, I am helping support local efforts. And there are no right or wrong answers here. The only right answer is your answer. And so maybe just a few more seconds, Savannah, and then we can close it out and share the results. And thank you all for trying out this new technology. I always like to explore and try new things as a way to see what does or maybe does not work so well. All right, so it looks like the poll has been ended. Savannah, do you have any results? Oh, there they are. Okay, so it looks like some of you said, I may have heard of this, and then others, maybe less certain. 2 of you said that is going on. Wonderful, thank you. Now, do I just go ahead and share my screen again? Is that how that works?
Yes, that should be. There we go. Yep.
Okay, we're back. Great, thank you. So we are going to transition into this next topic. So the state physical activity and nutrition program is one example of a way that we can target multiple levels of influence. I'm relatively new to Kentucky as well. We moved here at the end of August last year, so a little under a year, and this was one of the first programs that I had the opportunity to learn about. And so naturally, my first question was, what is SPAN? And since most of us are not sure whether we've heard about it, I think these questions will give you a good baseline of what it is. And so SPAN, again, that stands for State Physical Activity and Nutrition Plan or Program. This is a competitive grant from the Centers for Disease Control and Prevention. And I want to take a moment just to brag on the group of individuals and those who have taken over the project, because this is really competitive. Kentucky was only one of 16 states in the country to receive this type of funding to support these more foundational efforts in ways that will promote physical activity and nutrition across the lifespan. So snaps to all of those who worked on getting this. This is a 5-year award that began in October 2018 and will go on until September 2023. So they are currently winding down their 2nd year, and it has been a wild year at that, as I'm sure it's been for all of you. And so this grant is aimed to support the implementation of evidence-based strategies at the state and local levels. And kind of the way that I like to summarize what this grant means, essentially, we are working to support changes in the places that people live, work, learn, and play in ways that enable increased physical activity and improved nutrition. So my next question was, who does SPAN target? And the answer is, it's really targeting the westernmost and easternmost portions of the state. Essentially, this grant was written to really seek support for those areas with the highest need. And these are regions that have historically been underserved or have communities with limited resources. And those areas oftentimes demonstrate health disparities related to the fact that they are considered rural or they have a greater proportion of individuals, of people who have disabilities, or a greater proportion of people who have color. There are 5 geographic regions around the state. Again, the westernmost and easternmost portions, the Kentucky River, Purchase, Pennyrile, Cumberland Valley, and Big Sandy. The local health departments are the point people within these counties and areas that serve as the primary contact to organize and implement efforts at the local level. What does SPAN mean for these regions? There are 4 focus areas with this grant, and these were identified as key opportunities to elevate what is going on, to again target that lifespan to support healthier lifestyles through nutrition and physical activity. These focus areas include breastfeeding, active living, food service guidelines, and early care and education. The breastfeeding initiatives are aiming for ways to support the initiation and continued breastfeeding status, so really targeting that earliest phase of life. The active living focus area is looking at how to support functional land use, so promoting ways that people can be active for leisure and kind of their day-to-day lives, whether it's commuting to and from places that they normally go, or whether it's more recreational. The food service guidelines focus area is looking at workplaces like hospitals and health settings, as well as community settings like concession stands, as a way to change the types of foods that are available. So to improve the quality and the nutritional value of the types of foods that are there. And finally, early care and education. The priority areas here include supporting the professional development of childcare providers and increasing opportunities for physical activity and nutrition in ways that are fundamental to support a healthy start to life. The support that comes from this grant and the Department of Public Health includes financial support for the local health departments. This includes some salary support for those individuals who are being tasked to take the time and get things going. The support is also to make policy, system, and environmental change. These are those outermost layers that we looked at on our onion or our flour. And for anyone who maybe this is some new terminology to you, if you think about the types of programming we might be more familiar with, my background's in nutrition and dietetics, so I'm oftentimes focusing on nutrition education, what is healthy, and the skill sets that go along with that. For example, cooking. So how do we put together a healthy meal? And these are very important. People need knowledge and skills, but they also need spaces and places that enable them to make those healthier decisions. So if you've heard the phrase making the healthy choice the easy choice, the policy, system, and environmental changes are the ways that we go about supporting that. And finally, the Department of Public Health is going to provide technical assistance for local partnerships. They're really great at this. Part of this has included developing audits and assessments that local counties can use to assess things that are going well, kind of their assets, but also identify important needs. And through this, the grant can support and facilitate planning processes of how to address each of these topics. So these are specific activities in those regions I mentioned, but there are spiraling benefits that are coming out of this program and plan as ways that are supporting everyone across the state. And so Savannah, if you would like to pull up our next poll, we are going to go into our second question. And this is going to be about Senate Bill 45. And I'll kind of give you a hint to this. Similar types of answer options here. Kind of what do you know about Senate Bill 45? That first answer option will be, I have no idea. The second one will be kind of like, I think I've heard about it. And then part of it may be that you were aware. And then the fourth answer option was that you helped it come to fruition. And I don't want to do the spoiler alert yet because I want to see kind of where you all fall on maybe what you do or don't know about this piece of legislation. So we'll give Savannah just a few seconds to get that input. And if, Amanda, were there any questions or comments in the chat thus far that you'd like to bring up?
Not as of yet. I haven't seen anything in the chat, but I did have a question in terms of the grant and the counties that you showed a little bit earlier. Um, I am seeing a lot of connections that can be made between the work of the CECCs and the work of the local health departments with these funds. Um, and so are those counties, are those the ones that receive the funding to implement the program, or are they targeted where some other local health departments can use the same resources that you guys are creating to learn more about obesity in their, or health and nutrition in their counties? Does that make sense?
So let me see if I understand. And it looks like the question popped up. So while we're answering this, feel free to answer your questions in the poll. So I think I understood your question is, are the funds limited to those counties that were highlighted in green, or will these extend to other local health departments?
Yeah, sort of that, but then also, I know some grants say that the funds are going to be used to focus in specific areas, but the resources that are developed with the funds can be used by others.
Oh, okay.
Yes. So kind of both of those questions in one.
Great question. So Cindy Sullivan's on the call, and she works with the Department of Public Health. She might be able to answer in the chat or chime in.
Hi, this is Cindy. Those resources were at the beginning of the grant designed to, or were intended to be directed at those counties that are listed in green. However, as time goes on, if we see that, for instance, a county doesn't have the staffing or the resources or the ability, I should say, the staffing and the ability to carry that out, we could look at expanding it to other areas in the region. The thing that we would have to have is input from our local health department in order to consider that.
Gotcha. Well, I think that is a great opportunity for some of the folks that are on the call that are in counties that might not have been part of that targeted group to really advocate to bring some of these resources into their community. Is there any way that we can also get a list of those counties so that I can, make that connection with the chairs and the folks in that community? That would be really helpful, I think.
Yes, I can forward that to you. So it's in an email format after the call.
Fantastic. Thank you.
And just to piggyback on Cindy's comment, that there are going to be resources as a result of the grant that can be used statewide. So kind of yes to your second portion of the question. While some of the funds are directly targeted at these areas, we are going to, and that's the last topic I'll talk about, introduce Go NAPSACC as a program that will be accessible to everyone across the state. All right, I will go back to this. So it looks like some people have no idea, a kind of an even split, and then others that you may have heard of it. All right, thank you, Savannah. So let's go ahead and dive in. Senate Bill 45. This could have been easy to miss because it was pretty swift action. I was like, did I miss something here? It just happened. So you are not alone if you felt like you missed out on that. And so a little bit of context, Senate Bill 45 was introduced by Senator Danny Carroll out in Western Kentucky late last fall, and it was supported by the American Heart Association. And it went through pretty quickly. This was legislation designed to elevate health promotion standards of childcares, licensed childcares across the state. And without much, if any, resistance, it was signed into law on March 11th, which was right around the time there was a quick switch from life as we knew it to this healthy at home way and now healthy at work way that we're starting to function. And so what does this legislation look like? Essentially, Senate Bill 45 is it will require licensed childcare centers to meet standards regarding the most recent version of food and nutrition guidance for the Child and Adult Care Food Program. Some of you may know this as CACFP. There are also standards about physical activity, screen time, and sugary drinks. And I pulled this quote from a news piece from Senator Carroll, in which he said, essentially, these are standards that are followed by the vast majority of facilities, but this will bring all facilities under the umbrella, end quote. And so essentially, we can look at this as a way to kind of rise the tide, bringing everyone up to a more level playing field about the types of environments in terms of what children do and do not have access to. You might be wondering what has it looked like thus far? And so it is my understanding these standards are about physical activity and screen time and sugary drinks are going to parallel the 5210 program that has been promoted throughout the state for the past few years now, the Healthy Numbers for Kentucky Families. Essentially, the 5 talks about servings of fruit and vegetables, but there are more specific guidance on that we'll get to in a second. Less than 2 hours of screen time a day, but realizing that the standards are even less screen time within that time children spend in childcare, aiming for at least 1 hour of physical activity per day, and then really trying to eliminate any sugar sweetened beverages from being served within the childcare setting. The key difference in this legislation is going to be this portion about meeting the meal and snack guidance that was updated in 2017 for the types and amounts of foods, regardless of whether programs participate in CACFP. So CACFP, for those who maybe have not heard of it, is a way that childcare programs can receive support and reimbursement for serving families that have demonstrated a need. And so this includes specifications when meals and snacks are provided. So this will not apply to centers who maybe families send meals. So for example, my daughter's school, her preschool, we send their lunch. And so this would not apply to that. So applying to those settings that serve meals and snacks. And so in knowing that that is the most kind of the key difference, we have this question about maybe how do we support implementation? And that's where efforts are right now. We know that this is a strange and stressful time for our childcare providers, particularly as they are in the process of trying to reopen and figuring out what that looks like for them. So wanting to avoid any undue burden, but also wanting to make sure that we are creating those healthy environments for children. Again, kind of elevating those standards of maybe compared to what had been conducted prior. So we are in the early phases of planning what this will look like in order to provide more local support for maybe policies within the childcare settings, as well as modifying those environments. We are going to focus on menu development and purchasing resources. So realizing if childcare settings are going to need to meet standards, they may have questions about, well, how do my menus compare to what I've been using to what they need to be? Or is it that different? How do I make those changes to help meet that need? And then maybe how do I access those types of foods that need to be served? And so that's where the focus is right now. I will share that there are implementation planning meetings that have been established on a monthly basis, the third Tuesday of the month at 2 p.m. It is brand new. It's so brand new. I didn't even make it to the first meeting myself, but we welcome your attendance in sharing kind of local perspectives on what might be necessary to help the childcare settings in your community meet this new legislation. And you can contact Cindy Sullivan. Her email is on there if you're interested, and she can get you in with the program. Now, the nuts and bolts, again, how do we bring something that's kind of pie in the sky like policy to that boots on the ground of making those changes? And this is where the SPAN grant. So Amanda, to answer your question, this is where we get into an example. And Savannah, I will have you go ahead and open up that last poll. I promise you all I only have one more. Thanks for entertaining me on this. So this is where the resources from the SPAN grant are going to be opened and supportive of childcare settings across the state and not limited to those who are just within the target regions. And so NAPSACC, which we will talk about what NAPSACC means right after you take the poll, is a program that has been identified to support local childcare settings. with kind of technical assistance from a local coach or provider, but also kind of state level assistance to ensure that they can access the resources they need to initiate that change process. So we'll let Savannah pull up this final poll, similar to the other ones, wanting to know kind of what you know or don't know about NAPSACC. Maybe you don't know what it stands for. Maybe you've heard of it. I know that NAPSACC in previous iterations has been in use or sprinkled throughout the state. So maybe you or someone you know has worked with it. And there's our poll. Or maybe you know someone who's currently using it, because I will share we have a research study going on right now looking at NAPSACC, kind of the standard approach compared to what we're calling an enhanced approach. And I will get to that in just a few slides. So we'll give you a few seconds to answer this question. What do you know about NAPSACC? And then we'll close it out and I will walk you through what this program looks like.
While we're giving everybody a chance to take the poll, does anybody have any questions? Beth Schaefer did ask if we could get the list of counties again, and I think that we answered that the last time. We are going to be able to get that list of counties to you guys so that you can start building the relationship with your local health department, especially those of you who are on and have counties in your community, or in your new collaborative. I would definitely recommend starting to build that. But even for those who aren't part of those, you may want to reach out to your health department and see what they're doing, because it does sound like even without the grant funds, it sounds like there is some early childhood health and wellness programs that are being done through the health department. So that may be something that you want to consider as we move forward into this next fiscal year.
I think that's a great point, Amanda, and recognizing that health departments had to pivot, much like a lot of us, but they've really had to pivot these last few months. And so I don't want to speak on their behalf, but I imagine hearing from someone that they're interested in investment and invested in this would be helpful and welcomed. Okay, so pretty much I have no idea what you're talking about. Great. I am excited to show you kind of what this program looks like. So let's get back to this. All right. So NAPSACC stands for Nutrition and Physical Activity Self-Assessment in Childcare. The Go portion indicates that it's online now. And the purpose is to support improvements to childcare environments that foster healthy eating and physical activity and overall development in children. And just a quick little background about this, NAPSACC was created about 20 years ago as a paper format, and it was the result of a collaborative effort among researchers, public health professionals, technical assistance consultants, and childcare providers. It was first evaluated in 2005 and has kind of stood up to the test of time, if you will, and repeated evaluations to show that the program is effective in helping childcare providers make healthy changes that not only improve children's health behaviors, but also kind of before that, the environments in which they're learning in and playing in, so the health behaviors as well as children's weight. This program has been recognized from the Center for Excellence in Training and Research Translation as an effective evidence-based program, and it was involved and mentioned in a White House report as a model program to promote healthy habits in childcare. And most recently, I would say within the last 2 or 3 years, the Choices Project, which is based out of Harvard, looks at the cost effectiveness of a variety of interventions to either prevent or treat obesity. And Go NAPSACC was identified as the best value for investment in terms of money invested and return on investment in changes and the potential to influence a wide number of children. At this point, more than 20 states in the country are using Go NAPSACC. So what are those core components of Go NAPSACC? Go NAPSACC really takes a whole child approach. So wanting to support the health and physical development, cognitive development, language development, literacy and communication, social emotional development, and sensory development. I love this model. It's a lot to look at, and don't worry, we're going to unpack each of these sections. But this really kind of bundles the purpose and the functions and the process of Go NAPSACC into one. And so I would like to start at the core, which are these best practices. Go NAPSACC is centered on best practices. And what this means is essentially, what does the evidence show us for what we know can have a positive influence on children's behavior and health? These best practices were developed and identified through a rigorous process that includes using the latest scientific research and the most recent guidelines for the field. So, for example, the Caring for Our Children guidelines. The best practices represent the best available knowledge about how childcare programs can support the development of healthy behaviors in children. The best practices are organized into modules or content areas, which are kind of that circle that you see. There are currently 7 modules. I will tell you that they continue to add and evolve over time. So the 7 modules that are available currently include child nutrition, breastfeeding and infant feeding, farm to child care, so kind of a local foods focus on bringing local foods into childcare settings, oral health, infant and child physical activity, outdoor play and learning, and screen time. And so you'll note that a lot of these content areas are reflective of those standards that were addressed within Senate Bill 45. So then we get to this outer ring, which is the 5-step improvement process. So we can think about Go NAPSACC. We have best practices, we have content, but we also have a guided process. And this is where other programs sometimes maybe aren't as fully developed. Essentially, the 5 steps include assessing, planning, taking action, learning more, and keeping it up. The first step, assessment, is to assess current practices. These aren't tests or in any way to make anyone feel bad. They're simply an opportunity to look at and reflect on what are a program's strengths and what are areas for improvement. The second step is planning, and this allows providers the opportunity to set goals and create action plans for each goal and to stay on track. And the third step is to begin taking action to meet those goals. We have in this program access to a tips and material library that is full of videos and flyers and lesson plans. This is one of the most frequently accessed portions of the website. So even if providers haven't really done any formal assessment or planning, they are accessing the tips and materials library. And the resources in here have been vetted by researchers and practitioners who have experience in childcare, nutrition, and physical activity. The fourth step is to learn more. There is a library for professional development online learning opportunities that we'll get more into. And then the fifth step is to keep it up. So providers can reassess their efforts, see where they stand, and then kind of set new goals to move forward. So let's take a look at what it would look like when you or your local child care providers have access to this program. This is the landing page, the web page where people log in, and they will need to create an account, and we will share that information once we have access and are ready to use it. When individuals log on to the onto the NAPSACC website, they will have a personalized dashboard. This is essentially a one-stop shop for navigation, as well as a way to show you where you are. So this green bar on the left is a green navigation bar, and that can help you navigate to each of the sections that I've talked about. Oops, sorry. And then at the top of the page, there is a My Progress chart, so this number 2 area. And this will display each program's progress in each module. So as we can see, the child nutrition is a little green bar. And I'm sorry, my mouse is not really working right now. There's a blue bar that kind of indicates, there we go, infant and child physical activity. So this center we're looking at has started to assess themselves within these 2 modules. Then at the bottom of the page, you can see personalized activities. So where people are within the 5 steps of each module. So each module gets its own tab right here. It matches the icons, but then we can get a quick overview of where you are in terms of assess, planning, taking action, learning more, and keeping up. Essentially a one-stop shop to keep you organized. So let's go through it step by step, the self-assessment. As I mentioned earlier, best practices are the meat and potatoes or the centerpiece of Go NAPSACC. And in these self-assessments, each question is linked to a best practice. So each question is there for a reason. And self-assessment questions are grouped into sections, and this allows the self-assessment to be broken up into small pieces. We know childcare providers are a busy group, and so this website has been designed through kind of an ongoing iterative process between web designers, the research team, and childcare providers and technical assistant consultants so that it can become the most user-friendly format possible. And so in this one, we are looking at the foods provided section of the child nutrition self-assessment. Once we take a self-assessment, we can get a snapshot of our results. The number one on this slide is the overall results. You can hover, so it identifies if we're in a room for improvement area, if we're making progress, or if we're really leading the way in terms of the number of best practices that we're meeting. You can also get a more detailed output of your results. So this blue area is a great job. You're meeting the best practices, for example, for the foods provided, the beverages provided, the menu variety, and education and professional development. The orange box says we're on our way. So there's room for improvement in how we are looking at our feeding environment, feeding practices, and policies. We can get more specific. So with each of these clicks, you can begin to drill down to more details. So we can look at the best practices met, just specifically which ones, it will list those. But we can also take a peek by clicking this other tab of where we are not meeting best practices. And it's kind of nice. It lists the question, it lists our response, and then it also does a side-by-side comparison with the best practice. So it gives us a snapshot of where we are currently and where we can work to be. In order to assure that we are doing the best practice for children's growth and development. Once we have identified where we're at, we can then start to create action plans by setting goals. So you can look at where are some of these areas for improvement. We can click on them. Once you click on something, it can become a possible goal, and then you can select specific goals within those best practices that are not being met. Once you select a goal, it will be added to this list down here so that you can quickly and easily see what are those things you're focusing on. And for the sake of not biting off more than one can chew, we recommend limiting goals to between 3 to 5 goals per module, or at any one time, if you will. Once you've finalized your goals, we can start action planning. So your goal will appear where this number one, this blue box is. Your specific goal will end here. And then to make things as easy as possible, a template for an action plan is provided. We know that sometimes the hardest part is getting started. And so these templates are designed to minimize that barrier. There are specific steps that are suggested. They can be revised, they can be deleted, steps can be added. There's also space on the right-hand side to make notes about who might centers or directors need, who do they need support from, or what other types of resources. And then you can set a completion date. I don't know about any of you, but I do much better with timelines and deadlines. Now I just wanted to give you a quick snapshot of that tips and materials section that I talked about. This is kind of a gold mine, if you will, of information. Each module has its own section, if you will, and then within each section, the resources are categorized within subcategories. So it's those same types of subcategories from the assessment and the goal setting process. But even within those categories, then we can see, okay, we've grouped recipes and guidance, we've grouped classroom activities, and also things that relate to family engagement. When clicking on a specific tab, we can see there are tags, so it can easily identify whether materials are available in Spanish, or perhaps some keywords of content or activities that you would make it easy to search for. Providers also have the option to favorite. So if you really like something, you can click this star. It's added to your favorites tab, and it's a quick link at the bottom of the tips and material page. The training section is really growing as we speak. They will be releasing a lot of trainings in the upcoming 1 to 2 years. Essentially, these are online trainings that can be used to earn contact hours. And they're going to focus on the different modules, and they are currently developing a short kind of webinar, if you will, on each of the best practices within each of the modules. So there is going to be a lot of training coming out within the time frame that Kentucky will begin having access to this program. So it's really exciting. There's also a link to other great online training options through Penn State's Better Kid Care. All right, this is kind of my last nugget, but everything I've showed you thus far is really focused on the provider view of what their web page would look like, but realizing that providers are going to have technical assistance from consultants, local consultants in some way, shape, or form, and those consultants can access reports. So to get a feel of how are centers doing? Have they registered? Have they taken a self-assessment? What did their self-assessment show? Essentially, this is some information to help technical assistants or consultants provide tailored support to childcare centers. So realizing that everyone is in a different spot, and this will give them a baseline information of how they can best work with centers to help them succeed and meet their goals. And what does delivering Go NAPSACC look like? We have a couple examples of typical timelines. Essentially, once we have access to the program and have decided what rollout should look like for Kentucky, our local assistants will begin to recruit and enroll childcare providers. And once childcare providers are enrolled, they can then begin to receive training on the provider tools, so that online platform that we've talked about. This 5-step process typically takes, they call that a cycle. So one cycle on average can take about 6 months, depending on priorities, ongoing conflicts, changes in the way we know it. But this allows adequate time to assess, plan, take action, learn more, and then reassess. That's so kind of a 7-month period to get enrolled online and then working within the system. If you look at a 13-month, essentially kind of plans for 2 cycles within that time. I will tell you that planning efforts will begin later this summer. And so those who are interested and available, we want to make sure that we have a variety of voices and perspectives so that we can decide what Go NAPSACC delivery needs to look like in our state. And through this contract for Go NAPSACC, we will receive technical assistance from the team at the University of North Carolina, and they will help kind of guide us through this design process of personalizing our experience in Kentucky. So to quickly summarize, we've talked about a lot of different topics today, but I am excited about what is going on in Kentucky and the opportunities that we really have to build and expand upon efforts that you might already be doing. We have our SPAN grant regions, and so to Amanda's point, to reach out to those local health departments, we'll send that list. If you have specific interest or skill sets that would support any of the focus areas, whether it's early care and education, breastfeeding, food service guidelines, or active living, you can reach out to each of these individuals at the Department of Public Health at the state level. We have Senate Bill 45, which will be coming to fruition soon. I've been told Governor Beshear will have a ceremonial signing of legislation in early July, so you can use that as an opportunity to promote or support the legislation at your local level. Based on our poll and just the focus areas that we've all had the last few months, it's likely most people didn't even realize this was a thing. And so we'll need to start generating that awareness. And then we also invite you to participate in those implementation planning meetings so that we're really providing the resources and meeting the needs for childcare providers to orchestrate these changes. And finally, the Go NAPSACC program will be a new resource that's available. Looks like it's telling me my time should be done. And so we ask for your help in promoting to local childcare settings. I don't think I mentioned it, but this is appropriate for center-based as well as in-home. There are questions specific to each setting. And so with that, I just want to say thank you. I am excited to hear from you, your comments, your questions, your concerns, and look forward to being a support and a resource in upcoming years.
Thank you so much, Courtney, for this information. As I've stated a couple of times, I see a lot of connections between the work that the the councils are doing locally and the work that you guys are doing through the local health departments. And I really encourage those folks to who are out there to reach out to the local health departments and see what they're doing around maternal health and just learn more. So I do have a couple of questions over here. Christy, this one's more for me. Christy asked if the recording will be sent out to those who have registered following the event. Absolutely. Once the webinar finishes up rendering, Savannah will let me know. Uploaded to YouTube and send it out to everyone. I know there were several folks that weren't able to join us today, and so we will definitely do that. Would Dr. Luking or Ms. Sullivan be available to join virtually as CECC member as a special guest or expert guest?
Yes, I don't want to speak on Cindy's behalf, but I'm happy to join. And like I said, I'm new, so I would very much enjoy meeting all of you.
Yes, I would be available to do that.
Fantastic. So I will, once we get, in the next, probably tomorrow, once we get the webinar rendered and get all of that information out, we'll include contact information for Courtney and Cindy, as well as the list of those counties that are focused with the grant. So I'll get all that information out to you guys in one email. Are there any other questions before we go back over and start talking about some of the kind of closeout information for this fiscal year and moving into the next one? All right. Well, I would just like to say thank you again for joining us today. It was a lot of really great information. I think I had heard about the Go NAPSACC program many moons ago. Did not realize how how it has expanded over the years. So that is very exciting. Okay, so we have about 3 minutes left, so I'm going to go through some information with you guys really quickly. If I don't have time to get to everybody's questions, just email them to me and I will make sure that we get those answered. So for this year's grant, I did send out the contracts and the affidavits last Friday. So if you have not checked your email to see if those, I sent it to chairs and fiscal agents. So if you have not seen that email, let me know. I can resend and just make sure that you get that. For the signature page, I have started receiving some of those back. The only thing that we need in the contract itself is just that signature page where the chair and the fiscal agent sign it. That's the only thing that we need. For the affidavit, it does need to be notarized, but we have received guidance from the finance and legal departments of the cabinet that due to the COVID-19, the notary is not required at this time. But once everything starts to reopen, we will need that to be notarized and sent up to us. For the FY20 closeout, as you guys know, next week is going to be the official, June 30 is going to be the official closeout of this particular contract year. We have uploaded the annual report onto the new website under the Community Early Childhood Council's tab. So go there and take a look at that. Nothing has really changed from what was last year. So theoretically, you guys have seen it. We are probably going to be doing some changes with the upcoming reports. But for this year, it's saying pretty much the same. And I wanted to remind everybody that any unexpended funds must be returned by August 29th. I know that a lot of folks were looking at purchasing the family learning kits, which we're going to talk about in just a little bit. But we have those in, that those unexpended funds returned to us. Last week, you also should have received the family learning kit request list. There was some information on there. What we sent to you guys were the people that requested lists, as well as one of those columns will indicate whether the family received a kit or whether they did not. So hopefully that'll be really great information. Our office is considering the CECC owner of that data. So if folks are asking about, if folks come to us and ask for some of those lists, we'll refer them to you, because there is a lot of really great information in those that we have had some questions about that. So you might be hearing from me forwarding some of that information to you on who requested those kits. The other thing that I really wanted to make everyone aware of is to beware of over communication. A lot of these families are going to receive emails from several different groups, from the school district, from their child care, from a bunch of different groups. So as you're kind of considering how you're going to communicate with these families, keep in mind that they are getting a lot of information. And so we definitely don't want to over communicate with them where they kind of check out and don't, you know, kind of the information that we send them lost in all the other information that they're receiving. So if you do have any questions about that list, please feel free to reach out. I will definitely answer any question that you have. And for those of you that are already considering about how you're going to use this information, let me know. I would love to hear how you guys are planning on engaging with these families, following up with those families, the communication. I would love to learn more about what you guys are planning to do with that. So our next webinar will be July 29th at 10 a.m. We haven't determined exactly what it's going to be yet. We are going to ask folks to register again. So if you make sure, if you're not the chair or the fiscal agent, or just start spreading the word that we are going to start utilizing that registration page for the webinar so that we can get a little bit more information about who's joining us on these. So go ahead and mark your calendar for July 29th. As soon as we determine what that's going to look like, I will definitely send out that registration page. So keep a lookout for that. Okay, we have one other question. Other than the GOEC communication with families, who else, what agencies are involved with this? As of right now, that list of families who requested those family learning kits is just with the Governor's Office of Early Childhood. The communications that we've had with them up to this point has been about the family learning kit itself. So we, communicated with them when we received the request. We were communicated with them when it was being shipped and all of that. So I think that is the only information that we have communicated with them up to this point. And the Governor's Office of Early Childhood is the only folks that have communicated with them. So I hope that answers your question, Christy. All right, and with that, I will just say thank you again for joining us this morning. We really appreciate the time you're taking out. Thank you so much again to Courtney and Cindy for joining us and telling us all about this great program that you're building. And I look forward to seeing everybody next month. Talk to you soon. Bye-bye.